Welcome to Aging Matters, hosted by Senior Connection Center. I'm Patricia Henderson. Aging Matters is focused on providing you with information and resources relevant to aging. Joining me today are Kiralee Chambliss, Volunteer Manager and Shine Liaison at Senior Connection Center, and Sue Ferentz, Shine Counselor and Shine Local Coordinator for Manatee County. Welcome. Before we begin our conversation, let me take a moment to share why we are bringing this program to you. Each year in the United States, millions of individuals turn 65. Along with that milestone birthday celebration comes eligibility for Medicare. Navigating the maze of choices and enrollment deadlines for Medicare can be confusing, but there is help available from a program called Shine. Welcome, ladies. Kiralee, can you tell us what Shine stands for?
Well, first of all, I want to say thank you for having us on today. I know Sue and I are both very excited to be here to help spread the good word about Shine. And what Shine stands for is Serving Health Insurance Needs of Elders. It's part of a national program called SHIP, which stands for State Health Insurance Assistance Program. So the assistance that we're going to be talking about today is actually available across the country. And people can find their local program information by looking on the back of their Medicare and You book. And I'll have their local number right there on the back cover.
Great. So what types of services does Shine provide? Or can you tell us a little bit more about Shine?
Okay. Well, Shine provides free, unbiased, and confidential Medicare counseling for all beneficiaries, their caregivers, and loved ones. Shine in Florida is a program of the Florida Department of Elder Affairs and the Administration for Community Living. The program locally is operated out of the Senior Connection Center, which is the local Aging and Disability Resource Center.
So Shine does not represent any insurance company or sell insurance?
Oh no, absolutely not. Shine counselors are trained to provide unbiased counseling assistance, so we do not sell insurance or any products, and we're also not affiliated with any insurance companies.
Oh, that's wonderful. We are now in the middle of what is called annual enrollment period, or open enrollment, from October 15th through December 7th. So why is that important? Sue, can you share with us a little bit about why that enrollment period is important?
Okay, this is a period of time when people can change or add programs or contracts, insurance coverage. It's also known as the annual election period. For people already enrolled, it's called Already Enrolled Program. AEP can stand for many things, but it's important because for people to review what coverage they have to see if it's going to suit them best for the next year.
Yeah, and I would like to add that the coverages can change every single year. So that's, I think, the biggest thing for the annual enrollment period is if they need to make a change for the next year, that's the time to do it. And for most people, that's their only opportunity throughout the year.
Wow, it's an important time then.
Yes.
So what types of things can someone who is already on Medicare do during this period of time? Sue, can you give us a couple of examples?
Yes, there's many things they can do. If they're in a Medicare Advantage plan, they can switch their Medicare Advantage to a different Medicare Advantage plan. They can also go back to original Medicare. They can change what's more common is changing their prescription drug plan from one plan to another. And so those are the basic changes. They can also add a prescription drug plan if they hadn't had one in the past.
Right, because we find that many individuals haven't elected to enroll in prescription coverage because they weren't taking medications, and now they are. So this is their opportunity to add that Part D plan.
Correct.
which could
Correct.
save them money in the long run.
It could, and the longer they go without a prescription drug plan, the higher their penalty is going to be.
Okay.
So it's better to get in early.
Lots of things to consider. Now, does everyone have to re-enroll during this period of time?
No, some people are very happy with their coverage and would continue to stay in it, especially if they're in a Medicare Advantage plan and they like their physicians, and their physicians are going to continue in the plan next year. However, some physicians will say, I'm not going to take company ABC next year, I will only take DCF and XYZ. So then we would want to find a plan that suits them in those. And again, the prescription drug plan, however, many formularies or drugs offered by one plan may change or be not in the formulary anymore. So those are the people that want to change. They don't have to, but
Okay.
this is the time to do it.
So everyone doesn't have to re-enroll or sign up again for Medicare, but they should review their plans because plans change and people's needs change,
Yes,
correct?
yes, and the costs may change. Their deductibles, co-pays. They want to look at all of those options because it could hit their pocketbook if they don't change, because they will automatically be renewed into their former plan and come January 1st, and that's when sometimes they're not happy.
So it's important for individuals who are on Medicare, when they get that information in the mail from their plans, to read everything from start to finish.
Absolutely. I know they're bombarded with lots of information, but at least they should read the information for the company that they're currently enrolled in.
I would say that we hear from a lot of clients that they're just overwhelmed by the mass amount of information that's being sent to them, that is being shown on TV, on the internet. So a lot of times clients fail to pay attention to all of those important mailings they're getting. So I would say the best advice is anything from Social Security, anything from Medicare, anything from the insurance company you're already enrolled with. You definitely want to pay attention to that. If there are any changes to someone's plan, their prescription drug plan or their Medicare Advantage plan, the provider is supposed to mail the client a letter outlining those changes, and the client should receive it before October 1st. So that will also be very helpful to clients to determine whether or not they actually need to make a change.
So some people watching this program may have some homework to do during this time and reviewing all of that information. So what is something that people need to consider during annual enrollment period that would help them choose their plan or choose to stay on their current plan? What are some things that they need to consider?
Well, I would say they definitely need to consider what drugs they're taking, if they have pharmacies that they prefer to use, or if they prefer to get their prescriptions mailed to their home. What kind of costs they can afford. They need to look at the premiums as well as the co-payments. When you're talking about the drug plans, it's very important to also look at the different tiers for their prescriptions because that will impact their cost as well. People need to make sure that the providers that they want to use, their primary care doctor, any specialists they need access to, are all included in that plan and in that plan's provider network. Those are some of the top things that come to my mind. I don't know if Sue has anything else to add.
Well, I was just going to add, those are things they don't really have to look at, because that, as a Shine counselor, we will help them with that by using computer information and sort that all out for them, because it can be, they need to know, of course, what prescription medication they're taking and which plans their physician is going to take next year if they're in an HMO, health maintenance program, or a PPO, a preferred provider organization, which are under the Medicare Advantage plans.
A Shine counselor will sit down with somebody and review all of this information with them?
Yes, we can, actually we can do it very easily over the phone. I like to empower people to find the information with me. If sometimes I'll get on the computer one-on-one, they'll get on their computer, I'll get on mine, and I'll say, okay, now you see this here, and then they can learn to do it themselves. But we always welcome them to call us back if they have any more questions.
That old adage of teaching a man to fish.
Yes, I like to teach them to fish rather than give them a fish.
But we would never tell somebody, or Shine would never tell somebody what plan to choose, would they?
No. I always tell them if they can't make a decision, I'm not going to make it for them. I just haven't given them enough information, so they need more information to make the decision on their own.
Okay. And different things are important to different people. So Medicare is not a one-size-fits-all.
No.
Okay.
Definitely not. And we see a lot with married couples especially that they want to be on the same plan as their spouse. Sometimes we see it with friends or neighbors. Oh, I want the same plan that my friend has. She loves it. It works great. But the reality is you have very different needs than your spouse or your neighbor. So your individual needs and preferences are going to impact what plan may be better for you. And so it's really important to look at those kinds of things. We talk to clients all the time that have a varying range of priorities. Some people want the lowest cost plan no matter what. Some people want a plan that has access to a gym or something like Silver Sneakers, and that's a priority for them. Or a plan that might include some transportation benefits. So it really is a wide range, but it comes down to the individual, and that's something that we can help on a case-by-case basis.
Very good. Now, again, are there fees for Shine services?
Absolutely not. Shine is completely free, unbiased, and confidential.
Wonderful. What is the best way for someone to reach Shine?
Well, in the state of Florida, the best way for someone to reach the Shine program is by calling 1-800-96-ELDER. That's 1-800-963-5337. That's the statewide phone number for the Shine program, so someone can call from any county, and the line will help direct them to the appropriate office that can provide the Shine assistance. Another way people can contact Shine if they prefer is through our agency's website, which is seniorconnectioncenter.org. They can submit an online request for assistance that way rather than using the phone. So we don't want communication to be a barrier for anyone.
So that's great, using all methods of communication to help people with Medicare. Now, one of the things I wanted to ask is, outside of the annual enrollment period, what are some ways that Shine helps during those months?
Okay, well, anyone approaching age 65, we help them get enrolled in Medicare, and then in a particular path they want to take, how they want to take their Medicare. And to do that, they have 3 months before their 65th birth month to do that. We also help people with other programs to help them save money if they're eligible. If they're low income, there are national and statewide programs that help them with their pharmacy bills or their premiums, deductibles, and co-payments.
Okay. Now, I spoke with someone the other day, and their parent was having an issue with billing, and it was getting all messed up with the insurance companies. Is that something that Shine can assist with as well?
Yes, we can help with billing issues. We can help them file an appeal if they feel that Medicare has not paid a bill properly or denied it improperly.
Okay.
It's really help with anything Medicare related. We often get calls from clients who they saw a commercial on TV about this great healthcare program and they want to know if it's legitimate or not. So Shine counselors can help make sure that those individuals have the facts and can make an educated decision. Like Sue said, we can help walk them through the enrollment process if they're new to Medicare, kind of making sure they've got all their ducks in a row so they don't incur any penalties or anything like that. The claims, the appeals, the billing issues, and the financial assistance programs as well. Really, it's anything Medicare related.
Now, most people who are on Medicare are 65 and older, But there are some individuals who are receiving Medicare who are under 65. Do you also assist those individuals?
Absolutely. Shine is for all current and prospective Medicare beneficiaries, their families, and caregivers. So we've worked with clients who are in their 20s and are on Medicare due to disability. You can also qualify for Medicare if you have specific conditions such as Lou Gehrig's disease or end-stage renal disease. So if you have Medicare, Shine is happy to help.
That's wonderful. Sue, how long have you been a Shine counselor?
I've been, this is my 5th annual enrollment period, I believe. I've been with Shine for about 4 or 5 years.
So during that time, you've helped a lot of people.
Yes, I have. Yes, I have.
Could
Yeah.
you share a couple of stories with us?
Sure. One recent one came to mind. Client, just a routine, well, I want to review my prescription drug plan. The premium went up. And so I just did, we call them comparison of different plans that are out there. Manatee County has 24 different drug plans, so it's a lot to review. But we use the computer to sort it all out. We need their prescription drugs, and I was able to help this client save $100 a month by changing plans in the coming year. All of these changes are effective January 1st. Of course, they'd like to change. They'd like to save that money right now. But also interesting, something maybe should be mentioned, if you are getting some assistance, like low-income subsidy, extra help, they can change their plan in any month.
Okay.
So it's not just the annual enrollment period. If they're getting a Medicare Savings Program, they can call us any month, and we can change their plan for them.
Okay, so I know that there's a Medicare Savings Program that helps people with the Medicare Part B premiums and some other costs. And there's also a low-income subsidy or extra help that helps with the Part D cost. Can Shine help with those applications?
Absolutely. The Shine counselors can review those programs and eligibility criteria with the individual, and if they believe that the client is going to qualify, we actually have application specialists at the Senior Connection Center whose sole job is to help walk people through that application process and make sure that they get accepted into the program, understand their benefits, and how to use those benefits. So we follow up with them until they get to a comfortable place that they can move forward.
So reviewing the plan during annual enrollment period, finding out if you're eligible for one of the assistance programs can save quite a bit of money for someone. And so reviewing the plan isn't just an exercise in information, it is an actual way to possibly save money.
Absolutely, and I would like to add to Sue's story where she helped save that client $100 a month. We talk to clients all the time that are struggling with things like food and housing and transportation, so $100 extra a month can really make a huge impact on someone's quality of life.
Absolutely, absolutely. Now, Sue, you are a volunteer, is that correct?
Oh, yes, yes.
So you spend quite a bit of time doing this for the benefit of others, and we appreciate so much that you do that. What brought you to Shine as a volunteer?
Okay, it's kind of interesting because I was turning 65 around this time, and I was asking all my friends, well, what kind of Medicare do you have? Who do you have, or for your coverage and all this? And a lot of people said, well, this nice person came to the house and I signed up, and they didn't really know what kind of coverage they had. And then I saw an ad in the paper. It was like, it stuck out at me to volunteer for Shine, and I thought I had been in health insurance many years ago, but I thought, well, maybe I can do this, and the rest is history. I've had an excellent training, through the Senior Connection Center, and I really feel I can help people to make those decisions, because they're not easy decisions to make.
Well, thank you so much for what you do as a volunteer. what is the first step if somebody is watching and they want to become a Shine volunteer? How do they do that?
Well, I would say the first step if someone's interested in becoming a volunteer with the SHINE program would be to go to the floridashine.org website. That's the statewide website for the program, and that's www.floridashine.org. That's where they can find more information about the program to see if it really is something they're interested in. There's a direct link to join our team where they can view role descriptions for the different volunteer positions, and they can also complete an online orientation. It's about an hour long, but it's going to give the individual a lot of good information about the program, the ins and outs about what we do, the expectations, and so on. When they complete that orientation, it will actually generate a notification to me, and then I can reach out to the individual and kind of go over any questions they have and get them enrolled in a training class.
Okay, very good. Sue, would you encourage others to become Shine volunteers?
Absolutely. If you like helping people, it's very rewarding. I mean, we call it our psychic paycheck because people are very appreciative of our help. I'd like to add, you don't need any specific background to be a Shine volunteer. However, you do have to like working with computers, because that's where we find most of our information is on the computer. And that's what we do give. We give information, unbiased, confidential information.
So if you like working with computers and people, then Shine volunteering is a wonderful opportunity. And I can tell from talking with you that it's very fulfilling for you.
Yes, it is. Yes, it is.
So I want to just close out our program here and ask if you have any final thoughts that you want to share, Sue?
It's very important. The opposite side of not having a plan review is that we get calls in January where, I'm paying $400 for a prescription that I paid only $20 last year, and it's because they just stayed in their old plan. So we hate those calls.
Okay, so people need to do their homework
Yes.
and call Shine.
Yes.
Okay. And Kira-Lee, can you tell us again how to reach Shine?
Yes, you can reach Shine anywhere in the state of Florida by calling 1-800-963-5337. That's 1-800-96-ELDER. Or you can go to the Senior Connection Center website to obtain information for Shine for Hillsborough, Polk, Manatee, Highlands, or Hardy County, and that's seniorconnectioncenter.org.
If someone is out of state and they just happen to be visiting in Manatee County and watching, how can they find their local program? Because this is a program that is available throughout the country, but how do they find that number for them?
Well, they can try looking on the back of their Medicare and You book. If they have one, their local program information should be on the back of that book. But typically the program is going to be housed in the local area agency on aging in their state. So I would say that that's probably the first place they should try to call to find their local Shine information. There's also a lot of information online. And if you contact our agency and you're not in our service area, we will still try to connect you with the right phone number for your area.
And if someone does call Medicare directly, they're often referred to the local Shine program.
Oh, absolutely. We get referrals from Medicare all the time, so that would also be an
Okay.
excellent resource for people.
So 1-800-963-5337. Call Shine. We will be able to get help for you for the annual enrollment period. Or if you are 64 and inching up to 65, call us, call Shine 3 months ahead of time so that they can walk you through that process. Medicare is very confusing. Let the experts help you. And Shine volunteers, Shine counselors are the experts in this field. Any final comments?
Just thank you so much for having us here today. I hope some people learned something new. Hopefully they learn our phone number and they know to call us if they ever have any questions.
Well, thank you, Kira-Lee, and thank you, Sue, for joining us today. We are happy to provide this program to you in conjunction with Manatee Educational Television. I'm Patricia Henderson with Senior Connection Center. Thank you for joining us on Aging Matters.